Share my screen. Welcome everyone. We're going to get started in a couple of minutes. We'll give another minute or so for people to join. Looking at this image, it feels very cold. All right, let's get started. I'm sure we'll have some people continue to join us, but I'll start with introducing myself. My name is Rebecca Penn, and I'm the project manager for the National Safer Supply Community of Practice. Really happy to have you joining us today for one of our research spotlight webinars. So before we get started on our presentation and webinar today, I do want to take a moment for us to together acknowledge the role of colonialism in our past and in our day-to-day lives in our present. So we come together today, excuse me, in this community of practice from across Turtle Island as people who live on treaty lands and ceded and unceded territories. Our team and community of practice members are comprised of individuals and organizations from across Turtle Island. We are all treaty people. We work in a sector whose goal is to address social and structural harms. We recognize that the production of these harms comes from our colonial history and its enduring practices, institutions, and ways of thinking in our ongoing daily lives. We know that Indigenous people, as well as members of the African, Caribbean, and Black communities are disproportionately harmed, excuse me, are disproportionately harmed and criminalized by drug policies that are rooted in racism and colonialism. Colonialism is with us today, and we commit to working in ways that transform racist and colonial institutions and practices to repair harms, prevent future harms, and work towards a more inclusive and equitable future. I invite you today to let us know where you're joining us from. You can put your name in the chat and let us know where you're joining us from, your organization, what lands you live on. That would be great for us to see who's here with us today. Again, welcome. A little bit about our webinar today. We are recording this event and we will be sharing it on our website. If you're having technical difficulties, the simplest approach to solving that problem is to log out and then rejoin. We have closed captioning available in English. You'll find the closed captioning option on the bottom of your screen. Like I say, we will be posting this website, or sorry, the recording of this webinar on our website. We'll also share the slides from today's recording and from our webinar, and we'll also post any resources connected to the webinar today on our website, and that'll happen within the next 24 hours or so. We're going to do a poll about halfway through, and your participation in that poll is really helpful for us to demonstrate to our funders the value of the work that we do, and also helps us know how to help continue to offer webinars and programming that's useful for you. So ask that you participate in that. You will see that there's the chat box. We welcome you to make comments in there. The team, the National Safer Supply Community Practice team is present today to help share resources and respond to messages in the chat. If you have questions that you would like to put to our panelists today, I ask that you use the question and answer box what that does is it helps keep the questions separate from all the chat that happens, and it lets us follow along and make sure that we can have those questions available when it comes to our discussion part. Okay, so please use the question and answer box for any questions for our panelists. We do have a certificate of attendance available for you. Again, about halfway through the webinar, one of the team members will put a link in the chat that if you click on that link, it takes you to a form, you fill out the form, and shortly after that, you'll get a certificate in your email. We have some more webinars coming up over the next few weeks. On February 1st, I hope you'll join us to learn about what's happening in Alberta and what implications or what's happening there, what that could potentially mean for other places in Canada. So the title of that is the Ban on Safer Supply, an Alberta Case Study. The registration link is live. So you can register for that now. It's happening February 1st at 2 p.m. Eastern. And if you want to see more about what we're up to at the Community of Practice, I encourage you to check out our website. You'll see upcoming events listed there with links to registration. You'll also see past events that we've had with video recordings of previous webinars, our research spotlight webinars, as well as our hot topic webinars. We also have our evidence brief and other resources available for you there. You can also join the community practice if you're not already a member by clicking on the registration button on our website. And yeah, if you have any questions, please let us know. We're always here to help support your work and your understanding of what's happening in harm reduction and safer supply more broadly. And with that, I'm very happy to pass it over to Marlene, Emily, and Athena to share their latest report coming out of Safer Supply Ottawa. Thank you very much.
Thank you. Hi, everyone. Hopefully you can see my slides that I've just put up. Thank you so much for coming this afternoon. My name is Marlene. I am a registered nurse. I'm finishing my PhD and working as a research associate at the University of Ottawa with my supervisor, Dr. Patrick O'Byrne. I also previously oversaw the Safer Supply program, one of the Safer Supply programs here in Ottawa that you'll hear about today. For a couple of years before moving into this really awesome, really great research role. So today, myself and the rest of the research team will be discussing the results of our latest Safer Supply Ottawa program evaluation that we have been working on and kind of completed over the last few months. So just as a brief overview, we're going to speak briefly about kind of what the Safer Supply Ottawa program looks like. Then Athena will be talking about the most recent program data outcomes. After this, we'll get into more of kind of the qualitative research that we did. So things like the interviews, surveys, and then the future considerations that came from all of this. So just before Athena gets into her data, I wanted to provide a brief program overview for people who may not be familiar with kind of how things are all interconnected here in Ottawa. So Safer Supply Ottawa is a joint initiative. It brings together 7 different organizations to provide really comprehensive care and services within the community to people who use drugs. So if you look at the top, the 3 organizations there, Recovery Care, Somerset West, and Ottawa Inner City Health, are the Safer Supply kind of prescribing sites, and then the other services underneath are doing things like wraparound care and kind of supporting the overall initiative that's happening. So I will hand off to Athena now so she can walk you through her findings.
Hi, so I'm Athena. I currently work as a registered nurse. I'm a ER nurse now at the Deep River Hospital in rural Ontario. And then I still continue to do the evaluations for Health Canada for the Safer Supply project in Ottawa. Previous to moving out to the country, I used to, in conjunction with Marlene, also oversee the Safer Supply program for recovery care in Ottawa. So I continue that work by doing this to hopefully keep on providing data and ensure the program survives. So I'll be going through some of the quantitative data. This is data from the period of April 1st, 2023 to July 21st, 2023. So the last spring, summer. Some data I'll identify as being from intake, but most of the data I'm presenting is from that quarter that's or period that's recognized by Health Canada. Every 4-month period, we give them our data. So this is the data from that. So the sample includes participants from all 3 Ottawa pilot project sites. That's Ottawa Inner-City Health, Somerset West, and Recovery Care. In total, 531 individuals accessed the program at some point during that 4-month period. So by program type, we had 467 participants that I used reportable data from. Of the 531 exclusion criteria, which includes less than 3 visits, lack of quantifiable data, and more if they're focused on something else. We have some participants whose focus is more on mental health, for example. So those people I exclude. So with a total of 467 participants, I was able to collect data on for this period. This is a breakdown of the 3 types of programs I'll be talking about. We have Safer Opioid Supply, which is a replacement for the unregulated opioid supply, which currently is often fentanyl. Safer Stimulant Supply, which is a replacement for the unregulated stimulant supply. And then a combination safer supply where individuals are on both programs and they're prescribed a safer opioid and a safer stimulant concurrently. So this is some demographic information for everyone on the program. The median participant age is 40. We see people from 19 to 72 in the Ottawa area. 66% males, 34% female. 9 out of 10 participants are seen in English, with about 1 in 10 in French. And then we have an ethnicity breakdown that shows a little bit more FNMI individuals on program than related to the Ottawa area. Otherwise, the ethnicity breakdown has stayed pretty consistent and is self-reported by the participants on the program. So first, I will be talking about the fentanyl use trends from intake. So this represents the cumulative data of all the people who have fentanyl use data, regardless of their program type. That would be mostly individuals from the opioid supply and the combination supply. So this was a comparison of anyone I could find with intake data that was quantifiable, and I compared it to their most recent check-in from July 31st. So I could see beyond this quarter and how people do. Some people have been on the program since 2020, so I was interested to see how things change for them. And 83% of those participants reported decrease or no fentanyl use since program intake. So the vast majority decreased their use once becoming on a program. Okay, so next, the same thing, but for stimulant, comparing anyone that I could that I had quantifiable data from intake to their last check-in, that's July 31st. And this one, 97% of participants reported decrease or no unregulated stimulant use since intake, and no participants reported an increase in their unregulated stimulant use since their intake. This is for the period I'm talking about, primarily from April to July 2023. This is the Safer Opioid Supply Program. 1,249 people, or 53.3% of all participants, are on safer opioid supply, and we see a majority decrease in use, with 71% of participants decreasing their use. This is a comparison by gender. We do not see a big difference. We see similar trends of fentanyl use were present regardless of their participant gender. So this is the switching to combination safer supply. 40% of all participants, or 182 people, are on combination supply. Most participants report an overall decrease in both their fentanyl and their stimulant use, and similar trends are seen between the 2 of them, regardless if it's decreased, same, or increased. This again is a breakdown of gender for the combination safer supply. Small differences are seen. An overall trend of decreasing drug use is present across genders. So that is not a big change, but female participants report a slightly higher decrease in their stimulant use compared to their fentanyl use, and male participants report a slightly higher decrease in their fentanyl use compared to their stimulant use. But overall, it's a similar trend of decreasing use overall. This is a combination, or this is for combination safer supply, but it's looking at individuals at the individual level. I compare each person on the program's fentanyl and stimulant use just to see if there's a difference. Most people report a congruent decrease with 45%. And the overall, the three largest categories are all the congruent changes, whether it's congruent decrease, increase, or same. So there's either a relationship between people's ability to change their drug use, or it could be that's the way that it's reported by most people, but overall we see a congruent decrease for 45%, that's the largest category. This is the unregulated stimulant use program. So 7.7% of 36 individuals are on a safer stimulant supply program. And as you can see, the majority of participants report a decrease in their unregulated stimulant use as well. This is the gender breakdown for stimulant use. There's a noted difference between the genders, but there's also a noted difference in sample size, where we only have 7 female participants with reportable data compared to 29 male. So that is something to note when looking at this slide. We do see an overall decrease in use of stimulants for both females and males, but the female category has a slightly higher amount of participants reporting the same amount of use, with 29%. So that's the main difference in genders between the 3 programs. And then lastly, this is a study on overdose events. It's an inter-program sample where I found 307 individuals who positively reported that they are experiencing overdose events at the time of their safer supply intake. And then I compare them over the 4 months to see if they're continuing to overdose once they're on program. Even one overdose reported would flag them as a yes, they report an overdose event. And since starting the program, 82% of those individuals no longer report an overdose event at all during that 4-month period. So that's a lot of people. So we can say 4 out of 5 participants studied not experience an overdose event this period who were before joining the program. And all of this information will be available in the report. I went through it pretty quickly on the sort of for time's sake, but all of this will be available in the report if you would like any of the hard numbers.
Thanks, Athena.
No problem.
All right, so we're going to get into more of the kind of qualitative research results and what we did during this time period. So we spoke with the Safer Supply Ottawa working group, and there was a decision to focus the next research project on Safer Supply program participants who have been restarted on their program. So program restarts would include any participant who has stopped and subsequently started their Safer Supply program 1 or more times in the last year. So the research objectives, the reasons why we wanted to do this included, we wanted to explore this restart process. It was something that clinically the teams were seeing. It's certainly something that Athena and I also saw during our times working the programs. And we wanted to better understand the facilitators and barriers of consistent program engagement, as well as we wanted to be able to inform future directions for safer supply policies and programs moving forward. So the research questions included that we wanted to understand what circumstances are leading to certain people leaving and then returning to the program, why people might discontinue their safer supply program, what causes someone to re-engage and restart, and what happens to people when they are in kind of the time period off of their safer supply program. So similar to previous research that we've done, we did surveys and interviews. We ended up interviewing 30 participants across all of the different safer supply sites. The interviews were semi-structured. They took between 20 and 40 minutes, depending on the participant. We used thematic analysis to analyze the interview transcripts. Surveys were also completed to collect information about, socio-demographic data, self-reports of changes to health and substance use behaviors, things like that. So we used stratified convenience, meaning that we spoke with safer supply participants who were available and willing during site visits, while also trying to kind of get many different perspectives. And then at the end, participants were compensated $100 cash for offering us their time and expertise through participating in this study. So we're going to start off with the survey results, which we are reporting on just using descriptively. So the breakdown of the participants at each of the sites. So 11 participants total were from, you'll remember that kind of that circle. There was the 3 prescribing sites and then the 4 supporting organizations. So we went to all 3 of the prescribing sites. 11 participants were from recovery care. They have a Vanier, which is an area of Ottawa, and Byward Market, which is another area of Ottawa sites. So we broke it down kind of a little bit further with that, but in total there was 11. We had 11 participants from Ottawa Inner City Health and 8 participants from Somerset West. Participants had a median age of 38, with the youngest being 24 and the oldest being 61. Participants had a median or had been on Safer Supply for a median of 20.5 months. We did have, I think, a good mix of some people who were really new to the program, with the shortest amount of time being 3 months, and some who had been on their program for years, with the longest having been started on the program since before SUAP funding even became a thing, back in the summer of 2019, kind of when the programs initially started in kind of a really small way. We spoke to 15 women and 15 men. Almost everyone was born in Canada, and the majority of participants reported their ethnicity as white, followed by Indigenous at nearly 30%. So a third of people reported their sexual orientation, or sorry, 2/3 of people reported their sexual orientation as heterosexual and a quarter bisexual. Half of participants reported that they completed kind of less than high school. And everyone that we spoke to spoke English, but 57% said English was the only language they spoke. So for lifetime drug use, we did want to speak to people about their lifetime drug use. So as you can see on the graph, the use of crack cocaine was most common, followed by cocaine and fentanyl. The median age that people reported they started using any drug at all was 12. Median age for when people started to use opiates in particular was 20, and the median age for starting to use stimulants in particular was 18.5. Everyone that we interviewed coincidentally was part of a Safer Opioid Supply program. As Athena explained, here in Ottawa, we have kind of Safer Opioids, Safer Stimulants, and then that combination program. But everyone we spoke with was part of Safer Opiate Supply, which does make sense because it's kind of the vast majority of people are on that program. But 7 out of 30 people were also part of a Safer Stimulant program. Almost everyone was on some sort of long-acting opioid to help with their withdrawal symptoms, in addition to being prescribed their kind of short-acting hydromorphone, with 24-hour slow-release oral morphine, more commonly known as Cadian, being the most commonly prescribed to participants. So substance use complications, this is specific to complications that occurred before starting Safer Supply, so we're asking people to think back. Everyone that we spoke to reported having complications, but frequent overdoses and legal concerns were the most commonly reported, followed by hospital visits related to their substance use, Hep C infections, skin infections, endocarditis, and finally HIV. So similar to lifetime drug use, we asked about where people are using drugs. Supervised consumption sites and at home or at someone else's home are most common. And for the interest of the Ottawa groups as well, we asked people about kind of which supervised consumption sites they use. We have 4 of them currently available in Ottawa. And so you can see the breakdown at the bottom there. Unsurprisingly, all participants reported using harm reduction services, given that Safe Supply programs in Ottawa offer many of these kind of harm reduction services alongside or on site with Safer Supply. Participants did anecdotally express how helpful it was to be able to access kind of other services alongside Safer Supply. Sterile site distribution was the most commonly used by participants, followed by take-home naloxone, and then peer services. So engaging with people with lived experience. So now we're going to get into kind of pre-post self-reported measures for participants. We just wanted to kind of ask people about this to see from their perspective and from their reports how Safer Supply could be impacting certain factors. So with mental health, we asked people to rate their mental health on a scale of 0, which was poor, to 5, which was excellent, before they started Safer Supply and after. So before Safer Supply, participants reported their mental health at a median score of 0, and after after starting Safer Supply or at the time of the interview, they reported a median score of 4 for their mental health. So big improvement. Same question for fentanyl use. Before Safer Supply, participants reported using a median of about 5 points a day of fentanyl, And after Safer Supply, they reported using a median of 1.25 points per day. So another change that is also kind of reflects what Athena sees from the chart reviews that she does a couple times a year. So housing and income source, again, we're looking at before and after Safer Supply. So before Safer Supply, most participants reported staying in the shelter. Of the remaining, 6 were housed and 6 were unstably housed. And after joining the program, the number of participants in shelter dropped to 4 from 18 out of the 30 that we spoke with. So the number of parents overall that were housed increased quite a bit, and many people anecdotally reported Safer Supply supports and just the stability that they had gained with the program to be really helpful. And for income source, I think what's noteworthy here is that many more people, since being on the program, reported successfully applying and being accepted into ODSP to kind of get more supports, or that's kind of disability supports since starting Safer Supply. Our group in Ottawa wanted us to ask about victimization as well. So we asked people again to reflect on kind of before versus after Safer Supply. So we asked about things like instances of assault, as well as theft when conscious or unconscious. The most common experience of victimization before starting a program was theft while unconscious. So again, anecdotally, people mentioned overdosing or passing out after using unregulated substances and having things stolen from them. All categories overall of victimization were experienced less frequently by participants after being on a Safer Supply program. And the majority of people said that they experienced none, so that was 18 people, or less, 8 people, victimization as a result of their unregulated substance use since starting the program. So we were asking as well about overdose events and legal issues. On the left, you can see that while 28 participants reported experiencing an overdose event prior to Safer Supply, only 10 reported having experienced any overdose events since joining. This means that 20 people have said that they had been no longer experiencing overdoses since joining the program, which is great. And as for legal issues, all but 1 participant were experiencing some sort of legal concern before Safer Supply, and nearly half said they were no longer experiencing any since joining the program. One thing we did add is we wanted to get into more details regarding kind of criminalized behaviors a little bit more, because the previous graph really doesn't show scale of change. And so what I mean by that is the previous graph asks about legal issues, but it doesn't show that while some people may have been participating in criminalized behaviors and still be while on Safer Supply, there's still a change. So for example, instead of needing to participate in theft, survival sex work, assault and dealing, since joining the program, they only deal drugs when they do, which is quite a big change. So you can see that each category of criminalized behavior decreased, with theft being the most impacted with a 50% decrease. And all participants reported their criminalized behaviors either decreased, 16 people, or stopped, 14 people, since starting a Safer Supply program. So we're going to get into the interview results now. So 4 kind of major themes came out of the interviews that we did with people. People spoke about the experience. They really wanted to speak about the experience of being a person who uses drugs. They spoke about their time on the program restart process, and then of course, current implications and future directions. So we're gonna go one by one through these themes to tell you what we found. So the experience of being a person who uses drugs, although the focus of the study was on Safer Supply program restarts, participants really wanted to talk about their experiences of just generally being a person who uses drugs in the world, what this means to them and how it impacts their life. So from these conversations, 3 sort of sub-themes or some sub-questions emerged. So things like the factors that surround drug use, the experience of being a person who uses drugs, and when people start programs. So the factors that participants spoke about reported influencing their drug use can be categorized by internal and external sources. So while we'll be speaking about these separately, it's important to note that internal and external factors per the participants really influence one another and impact a person's overall drug use. So people spoke about, with regards to internal factors, participants spoke about many different things, but the most common reasons the most common things influencing their drug use were kind of mental health and pain management concerns. So on the left is mental health. Across the interviews, many participants described how drugs allowed them to manage distressing mental health symptoms. Most commonly, participants found that drugs really helped them to manage traumatic memories and flashbacks related to experiences of abuse and trauma from their past. Some participants also noted that drugs allowed them to feel well and like themselves, such as the top left quote where a participant noted, "If I'm not using drugs, I'm not myself. They help me to be a more functioning member of society." On the right, we have pain management. People describe this as well commonly as a common thing influencing their drug use. Some participants reported debilitating pain that impacted their quality of life and their ability to function. People often told stories of being unable to find the support that they needed from healthcare services to manage their pain, and thus they needed to self-medicate. This was also a really common story as to how people ended up using things like unregulated fentanyl, cocaine, crystal meth, things like that. So with regards to external factors that influence drug use, people most commonly spoke about ongoing stigma and judgment, as well as environmental chaos having an impact on their drug use day to day. So in the top, participants reported stigma and judgment from people outside of their community as an ongoing occurrence in their lives. They spoke about this having an impact on their self-image and how they interacted with others and just generally the world around them. Participants did feel as though there were many misconceptions about substance use and felt overall just very misunderstood and ultimately marginalized as a group. People did also speak about environmental chaos and kind of the stressors there, and how they felt like violence had been escalating in certain areas of the city. And this was very distressing for them and caused kind of more instances of trauma and violence in their lives. So experience of being a person who uses drugs. So first, participants wanted to speak about the toxic unregulated drug supply and how concerned they were, not only for their own safety, but the safety of their community in general. Grief and loss came up with almost all participants. They reported having experienced many close friends and family members dying as a result of the toxic drug supply. People spoke about really struggling with their grief, given the constant and overwhelming experience of having people die on a quite a regular basis. Low self-worth was also discussed, often impacted by the experience of stigma and judgment by people outside of their community. Shame, embarrassment, and regret were commonly mentioned. So the final sub-theme and theme one that people really touched on was just about kind of the time just before they were starting the program or when they were just starting. So this will tie back into theme 3 when we get into restarts, but overall, people tended to turn to safer supply programs when they felt they had hit what they described as a low point in their lives. So for example, people spoke about experiencing frequent overdoses, having people around them dying, feeling constantly dope sick, feeling suicidal in the time just before starting the program. They also spoke about feeling really isolated from adequate support and overall just feeling unsure about how to manage their substance use on their own. So the second theme is reflective of the time on the program. So we did develop a figure from the interviews that we did with participants that kind of captures the cycle or trajectory of substance use, safer supply program engagement, and kind of that program restarts topic that we were getting into with people. So we'll follow the steps laid out in this cycle through themes 2 and 3. So the first thing that we'll talk about is this program entry. You can see highlighted on the top left. So participants were able to clearly recall being started on the program. This was a really important milestone in their lives. One participant described starting Safer Supply initially as like winning the lottery, while another said they were excited as they were hopeful Safe Supply would allow them to move away from using unregulated substances. Participants had, really unique reasons for starting Safer Supply. It is absolutely a personal decision for each individual, but overall, the goals included kind of either or both short-term immediate reasons for starting and more long-term hopes and goals for the program, for being on the program. So short-term goals and immediate needs included things like avoiding drug overdose and death or severe injury as a result of their drug use, as well as avoiding the toxic unregulated drug supply, having a better control over dope sickness, and really addressing kind of health concerns. Long-term goals, as reported by participants, included things like finding stable housing, going back to work or volunteering, having safer or reduced drug use, reconnecting with loved ones, improving hygiene, and just overall, people talked about having more normalcy in their day-to-day life. So within the sub-theme of program experience, participants noted 3 major impacts. They talked about that Safer Supply having an impact on their drug use, an impact on their quality of life, and then the overall benefits that they associated with being part of Safer Supply. We'll go through each of these. But before we do, I did want to point out that when we compare what participants said their goals were in the slides just previous, and now what they state their program outcomes are, these really do seem to match in many ways, meaning that participants are reporting that Safer Supply does seem to be meeting their needs and the initial goals that they did set for themselves. So with regards to impact on drug use, participants spoke about their drug use changing in different ways with an emphasis on their personal recovery not always being synonymous with abstinence. While many participants did have an end goal of ceasing their substance use altogether, there was many steps in between for lots of people, including things like reducing drug use, having safer drug use, or even changing the way they're using drugs. So for example, people going from injecting drugs to taking drugs orally. People also spoke about how changes to their drug use resulted in things like reduced overdoses, reduced participation in criminalized behaviors, and improved mental health overall. With regards to impact on quality of life, people spoke about kind of their overall quality of life improving. The positive experiences of interacting with Safer Supply staff were mentioned by the vast majority of participants. Participants reported feeling really welcomed and cared for within the programs, and that contrasted with stories that they told us about kind of negative experiences within the healthcare system. Reconnecting with loved ones and children was mentioned by a few participants, and others kind of just speaking about really refocusing on important relationships in their lives. And then finding housing was also discussed by a number of participants as an essential piece of them being able to find some stability in their life. Overall, participants noted that Safer Supply allowed them to reclaim time in their life to be able to focus on things that were important to them. And then finally, with regards to overall benefits, being able to reclaim their time allowed for many participants to engage in meaningful activities. Participants described this as, quote, being able to do normal things, which included things like drawing, doing crafts, exercising, big things that sometimes we take for granted. Safer Supply also offered for some people routine and stability. Being involved in the program helped them to create a schedule and refocus their time. They also spoke about feeling like they have more hope in their lives and hope for the future, as well as an overall sense of safety about what they're consuming and knowing that their Safe Supply will be ready for them each day. Before we move on, Rebecca, did you want me to pause for a moment to do that poll, or is that something you're just sending out in the chat?
Yeah, no, carry on, and when we move to discussion, we'll do the poll. Thanks for checking.
Perfect. Okay, great. So next in the figure, we're going to move to kind of program challenges that some people faced. So in particular, what we touched on, given it's been kind of a hot topic, was about diversion, medication diversion, just given how often it's brought up in relation to Safer Supply programs. We really wanted to give participants themselves the space to be able to speak about it in their own voices. So first of all, it's important to note that participants did not deny that diversion was happening. They felt that diversion overall was an extremely misunderstood topic, and that labeling all diversion as the same had the potential to be very harmful to understanding why this happens. Participants spoke about several different types of diversion, pretty similarly to what you'll see or you've seen in the National Safe Supply Community of Practice diversion paper. Participants similarly spoke about many different types, and we'll go through these one by one. So first is safety. Participants spoke about diversion that was happening and that it helped provide safety for those who were not on Safe Supply programs. You know, in Ottawa, we have over 500 people on the program. There are tens of thousands of people who use drugs in the city, and the programs are constantly full, or at least at capacity, usually beyond. And so there are lots of people who would benefit from the program, or who really would like to get on the program and who can't. And so participants spoke about them with regards to kind of safety. And the idea here is that people will be purchasing drugs, whether safer supply programs exist or not, and diverted safer supply medications provide an increased layer of safety over the unregulated toxic drug supply. People spoke about compassion. They spoke about that they remember the feeling of being really dope sick and how horribly painful this experience is. They said it's really difficult to stand by and watch a loved one going through really intense withdrawals. And they also spoke about the fact that things like sharing and caring is just part of this community at baseline. You know, people who use drugs really look out for each other, especially because they feel really marginalized and not cared for in other places. Meeting needs. So people were happy overall with the Safer Supply program, but in particular for people who were on safer opiates but not on safer stimulants and consumed unregulated stimulants. Sometimes people did trade things like the hydromorphone for other types of drugs like crack and meth. Some people might trade their Safer Supply for a stronger opioid when the hydromorphone was not potent enough that day to manage their cravings and withdrawals. Survival was brought up as well. So people spoke about the fact that, you know, stopping unregulated substance use altogether takes time. And many participants who kind of were in that process of kind of sorting that out really struggled. And diversion was seen as a way to avoid participating in criminalized behaviors like theft, survival, sex work, things like that. And then finally, pressure. Participants did speak about instances of definitely feeling pressure by drug dealers in particular, into feeling bullied into giving other people their safe supply medication, with some participants referring to experience of violence they've gone through because of this. So this kind of summarizes, I think, a lot of what we got at with participants. But one participant stated that drugs are out there with any type of program, whether it's through a doctor for pain. There's always going to be people getting rid of drugs or buying drugs. It's everywhere. It's not just Safer Supply. It really reiterates the point that diverting and sharing meds is not a new phenomena. It happens with OAT programs and outside of substance use programs altogether. And for the people who are looking for drugs, will be able to find them. Participants did bring up quite a bit around youth diversion, and we wanted to speak to them about this as well, because again, there's been lots of media attention regarding kind of the public's concerns about medication being diverted to youth, and we felt it was really important that they had their chance to speak for themselves. Participants were extremely consistent with their responses that youth diversion is just not happening. Many participants spoke about the fact that within their own community, there are procedures in place among people who use drugs for when youth might be in the area or walk by. They spoke about yelling things like "kids up" to let everyone know to put their drugs and drug use equipment away so kids didn't see them. Participants were very distressed by the thought of people thinking that their community diverts or shares with youth. They noted that they felt this once again relates back to the stigma and marginalization experienced by people who use drugs, which results from misunderstandings about the community. So they spoke very passionately about this. So the third theme includes the program restart process. So while each participant had their unique experience of being kind of off their Safer Supply program, because that was the focus of who we were kind of speaking with before being restarted, they all followed a really similar trajectory, which is why we sort of created that that figure that you saw earlier. And so overall, we're going to go through the sub-themes of crisis, time away from program, and restarts. So within the surveys, we did ask people about kind of this specific restart process. The vast majority of participants reported during the most recent Safer Supply program restart, they were away for the program for less than 7 days. And over the past year, participants reported being restarted on their Safer Supply program a median of 2.5 times. So moving into this piece of the figure. So the first step of the restart process is the crisis period. Participants spoke about an event often described as a crisis happening in their life, resulting in them being unable to continue the program. We'll look at some quotes in the next slide. Overall, people the most common crisis kind of things that people brought up were things like being incarcerated, hospitalized, being removed from the program for having staff having witnessed diversion and experiencing intense dope sickness, having to travel, struggling with daily pickups, and other drug use. So one participant spoke about being removed from the program for diverting their medication. They were eventually put back onto the program after kind of coming up with a plan with the team for how to adjust this. Other people spoke about things like having to travel out of town, such as the bottom right quote, where the participant had to attend a funeral last minute and it just couldn't organize in time to have a pharmacy nearby to dispense their medication to them. People spoke about just being too dope sick to be able to make it to the pharmacy on certain days or using other drugs. Most often it was unregulated stimulants, as most of these people were on safer opioid supply programs. That sort of thing distracted people from being able to get to their medication in time. Participants found that daily pickups were really difficult and were asking the programs to consider putting people on more carries. And in the bottom left, you can see a participant speaking about not being given what they needed while they were sick in the hospital. So instead turned to getting people to drop off drugs to them so they could stay and get care. So moving into kind of the time off the program. Being away from the program was often characterized as a time that was really difficult for participants. Some of the people we spoke with became quite emotional during this part of the interview process when they recounted this time. They spoke about things like being concerned about their own personal escalating rates of overdose when they weren't on Safer Supply, increasing levels of unregulated drug use, worsening mental health, and just feeling isolated and like they had lost their community. I would say overall, people spoke in general about kind of an increased sense of chaos. I did also want to point out incarceration as a particularly difficult time for participants. From what they told us, we heard many stories about people saying they were forced to detox in jail. The participant on the left spoke about being isolated for days in a cell, only to be told that they had now been off their safer supply and long-acting opioids for too long and needed to be restarted at a dose of 5 ml methadone, which for anyone who has been involved clinically in a program knows that's an extremely small dose. And just felt really upset about this because it wasn't their choice to have been off their meds for that long. The participant on the right spoke about having never been offered anything with regards to their opioid use while they were kind of incarcerated. And these were stories we heard from all participants who had been to jail or prison while on a safer supply program. So it was really common and it was quite consistent. They were quite consistent with these stories. So the final step on the figure is the restart process. So in the end, participants disclosed returning to their programs for different reasons. So many participants spoke about just having growing concerns over their unregulated substance use, and this kind of being the driving force that ultimately led them to return to their program. People spoke about escalating frequency and severity of overdoses while off the program. And then also a number of people spoke about things like needing support, that they really missed the engagement that they got from the program. I would say that overall participants said they felt really supported by the program when they re-engaged, and that once they were actually engaged in that restart process, things kind of moved along pretty quickly. So I would say overall lessons learned from this are that it wasn't difficult to find people who had been restarted on their safer supply program. We had no issue recruiting for the study. Almost all people that we spoke with had done this at some point. And so this is a really common thing. This kind of leads us to understand that restart should be considered a really normal part of the program trajectory, and that there's often a precipitating factor, a major escalation of chaos just before leaving the program that really emphasizes the need for really comprehensive wraparound care that can be kind of scaled up and down depending on where people are at. With the process of safer supply, it was really clear that people spoke about, changing substance use patterns is not a linear path. It's highly complex. Moving away from previous patterns and ways of life takes a lot of time and practice, and that substance use programs, might work people for a period of time. This includes Safer Supply, OAT, could be any sort of substance use program, and then they may not for a while. And just generally that our needs change as our lives change. And that Safer Supply overall helps people to not have their lives consumed by unregulated drugs. So I'm going to hand off to my colleague, Emily, now to go through the last theme.
Right. Sorry. Hi, everyone. I'm Emily, and I'm the peer consultant that worked on this project. So I'm currently a Bachelor of Social Work student at Carleton University here in Ottawa, and I also work at Ottawa Inner City Health, which is one of the Safer Supply prescribing sites mentioned in the study. So I'll be talking about our fourth theme we identified, which is current implications and future directions. And this section will provide an overview of more specific feedback about being on a program, as well as looking at future directions for the program based on the research that we have done. So the first section is about program feedback that participants provided. Specifically, participants wanted to offer input surrounding three major areas of being on an SS program, that being check-ins and pickups, dose increases and decreases, and accessibility and safety. I apologize. So we noticed from our feedback that reactions about check-ins and daily medication pickups sort of fell on a spectrum of emotions ranging from more negative to positive. While some enjoyed the check-in process as a way to engage with staff, alter treatment, and work toward treatment goals, other people remained indifferent, accepting check-ins and pickups as part of program expectations. Sorry, I'm kind of losing my voice. As well, a few participants found the check-in process to be frustrating, repetitive, and at times invasive. Overall, participants accepted the fact that this is part of the program and were willing to be accountable to their role in the process. So while most participants showed understanding of the increase and decrease process, they wished to express some of the difficulties that they experienced with it. Participants identified how dose increases can be difficult to obtain, which leads them to using more unregulated drugs like fentanyl instead. They also expressed frustration with the pace of dose increases. They found that they were often too slow and that this led to distress. Further, there was some confusion about how to request increases in medication expressed by a small number of participants. And overall, they stated that they could benefit from more ongoing communication from program staff about protocol and policies. So participants found that the commute to pick up their medication could be very difficult, especially as they were expected to come on a daily basis. Although pickups from other pharmacies are a possibility, pharmacies outside of the areas directly serving Safer Supply programs are often unfamiliar with the program, and even if people wanted to pick up from there, it could be challenging. Coming in for weekly check-ins can also be a high barrier for people, particularly when they don't live in the area of their program and they have to commute long distances. This speaks to the fact that clients could potentially benefit from more flexible ways to check in, such as virtually or over the phone. Moreover, people have found that the downtown area is a bit rougher and that they are experiencing more violence. Oftentimes, dealers are present outside of known safe supply clinics, as Marlene mentioned, waiting for people to come out with their meds, and participants have even spoke about being assaulted for their medication. Participants identified that more carries of medication or offering a home delivery option could help mitigate some of these challenges, as it can be difficult to move on with life and goals when you need to go to the pharmacy every day. So next, we'll discuss two findings that arose from our research with participants, that being implementation of drug alternatives and challenges with opioid agonist therapy. So there's this common notion that people obviously still want access to fentanyl, but they're afraid to access it from the toxic drug supply. One participant described this finding quite clearly, stating, "I wish it was more like fentanyl, not because I want to die, but because I like the feeling. I don't want it to be fentanyl where I'm going to die. I just want the fentanyl where I'm going to have that feeling." So that leads us to discuss safer alternatives that were proposed by participants. As participants expressed that fentanyl is more potent than their safe supply medication, which can lead to more unregulated fentanyl use, they proposed injectable fentanyl as a potential medication alternative in safe supply programs. Moreover, a few participants expressed how they missed heroin, and they felt that it would be a safer alternative rather than accessing unregulated fentanyl. And so programs and treatment may work for some people for some time, but as circumstances change and as the drug supply changes, the program needs to evolve and change with them. This leads us to talk about how methadone can be effective for some participants for some time, but as unregulated drugs become more potent, it can no longer be enough to manage withdrawals. So participants did express some challenges with opioid agonist therapy. They expressed that using OAT led to poor mental and physical health problems. Further, participants identified that OAT often left them feeling too sedated, which could interfere with their daily life. And lastly, participants discussed that OAT led to strong withdrawal symptoms, as I mentioned, that would impact treatment success. On the more positive side, participants did explain that OAT was a helpful treatment in combination with their safe supply medication. So although OAT on its own hadn't worked for some, this highlights the benefits of individualized treatment. And lastly, we'll be talking sort of about life without Safer Supply. So participants were aware of the limited funding that Health Canada offers to these programs. And so we decided to ask them about how they would see their life changing if Safe Supply programs were to end. So first, participants discussed how they would feel the need to return to criminalized behavior for survival. They expressed distress as they did not want to engage in such activities, but they felt like with program closure, they would have no other choice. So this would leave them in a debilitating cycle of survival and remorse, where people would have to do things they don't want to do in order to be able to purchase drugs. Participants also worried that without their safer supply medications, they would need to return to accessing drugs from the toxic drug supply. And as the composition, potency, and contamination of unregulated street drugs can be unpredictable, participants urged this would lead to more overdoses and loss of life. Lastly, participants discussed that without the Safer Supply program, they would lose their sense of purpose and routine that they developed. They expressed devastation at the idea of program closure, as everything they had worked toward would be lost. Overall, it's clear from participant reactions that closure of Safe Supply programs would dramatically alter their lives and well-being. So to wrap up my section, participants were given the opportunity to have their reactions conveyed in their own voice. So here are some of the message they wanted to share to those in charge of Safer Supply programs. So participants wanted to say thank you for having the program, and they wanted to get the message across that this program keeps them alive. As well, they wanted to express that this program keeps crime rates down and that without it, there would be more issues. Moreover, a participant noted how the cost of drug use is expensive regardless, and that this program does work, and there's people out there that there's more people out there that could benefit from it. And lastly, they wanted to express that despite the fact they use drugs, they are not bad people and they deserve help. So that's all from me, and I'll hand it back to Marlene.
Thanks, Emily. We're almost at the end of the presentation, and then we can kind of get into questions, which will be a lot of fun. So what does all of this mean? So as part of this research process, of course, we wanted to see kind of how participants thought the program should evolve, what did they want to see next, and kind of how does what we spoke about tie into how the programs could just overall evolve. So people spoke about wanting more flexible programming, things like pharmacies, pharmacy may be delivering things to them rather than needing to pick things up daily. So doing more home deliveries. People also spoke about innovative care delivery models, such as telephone check-ins, virtual meetings, which some of the programs are doing already. Certainly we have been for quite some time, but kind of just expanding that to kind of like a larger extent. People spoke about things like individualized care. People spoke about just wanting the program to evolve with participants. You heard Emily speak about that. Youth programming. I did want to touch on this just for a moment because participants were clear that diversion to youth wasn't happening. Although when we did discuss this, lots of participants also spoke about the fact that they do have a lot of concerns about the lack of services available for youth who use drugs. What we do know about youth is that during the pandemic period, fentanyl and its analogs directly contributed to nearly 95% of opioid toxicity deaths among adolescents and young adults, which is a significant increase compared to kind of the prevalence prior to the pandemic. And further, in the wake of scaling Safer Supply program, you can see that hydromorphone did not contribute extensively to opioid toxicity deaths among adolescents and young adults. However, what we should be concerned about is that youth do remain very underserved with regards to substance use treatment. So Public Health Ontario put out a report, which I'm sure many of you have seen, that said that from 2014 to 2021, there's been a steady decline in the number of youth receiving OAT services alongside growing rates of emergency department visits, inpatient hospitalizations, and deaths from opioid toxicity. So this is a massive concern for people, of course, and for the community, and something that certainly needs to be addressed, something that we need to think of kind of as a community. Sustainable planning. So some participants were aware of that time-limited funding. They were concerned about what happens to them if it ends, how programs will continue. This was really important to them. People spoke about drug alternatives, wanting expansion of safer stimulant programs. We do have some here in Ottawa, but not nearly as much as opioids. And so people wanted more access to safer stimulants. They wanted things like injectable fentanyl and injectable diacetylmorphine or pharmaceutical grade heroin. They wanted things like a review of prescribing guidelines. Many of the guidelines that exist, whether, there's a ton of them online, Ottawa has their own as well, are from things like 2019, 2020, 2021, and they're not reflective of how much the unregulated drug supply has changed since programs really kind of started to take off in 2018, 2019, 2020. And so it'll be important to look at how medications are increased over time, what the maximum doses of medications are, as well as how people are restarted on the program, to make sure that we're keeping up with needs. And then as for addressing diversion, people spoke about wanting, to really make sure that diversion is being reframed by the overall kind of safer supply community in Canada. Of course, the National Safer Supply Committee of Practice has their great diversion framework that really was reflective of what people were saying in many ways. And that overall, they just wanted to make sure that people were considering diversion through the context of the culture of drug use. That diversion is very multifaceted, just as multifaceted as the community of people who use drugs is, and we can't simply group diversion under one heading. And then for program restarts in particular, people kind of similar to wanting guidelines updated and wanting guidelines to really be more reflective of what's happening. People were asking for things like faster medication titration, things like on-call services to quickly serve participants on evenings and weekends and holidays. They were wanting really clear communication at program intake and ongoing. Things like making sure people know that restarts are normal and expected and part of the process, and it's okay to come back and re-engage, and in fact that teams want them to, how people can engage in times of crisis, and that people need reminders and cues to be able to meaningfully engage in the program. They want areas that there are certain areas that really need to be addressed that kind of lead to this program restart process or time off the program. In particular, jail and prison. We need to work kind of harder or more, or really engage more with kind of these groups to make sure that we are able to have this consistency in care, as well as hospitals and in times of travel and moving. Because people, who might want to move elsewhere, it can be very tricky, very difficult if there's not a safer supply program in that area to take them on. The provision of education kind of in these areas as similarly, they want to see, or we know that they want to see more things like implementing wraparound care that can increase or decrease in intensity as needed. And then program changes, again, that guideline looking at how we can update things to make it more reflective. The Ottawa group has begun for, I'd say, at least a year, doing things like more medication carries, less frequent check-ins with people. But I think kind of really taking a step back and looking at the broader guidelines and seeing what can be evolved will be really important. So thank you everyone for coming. This is our third research evaluation that we've done. You can read the other two reports right now on the Safer Supply Ottawa website. This report should be released tomorrow if all goes well. And I will post in the National Safer Supply Committee of Practice Google group when it's available so that everybody can kind of check it out. Because even though it was a very long presentation today, there's lots more that you'll be able to kind of dig into in the report. And thank you so much for coming. We're so happy to be part of this community.
Thank you, Marlene, Athena, and Emily. That was an amazing presentation. There's all kinds of comments in there thanking you and saying how much valuable information is there, and people responding to the emotional component of it all as well. And we will also be posting the report with this video recording on our website as soon as all of that comes together. Let's just quickly take a second and do this poll. That's really important for the community of practices statistics. But while you're filling out the poll, we can continue. You'll see the poll is up on your screen now. If you do have questions you'd like to ask, Athena, Emily, and Marlene. You can put them in the question and answer box. There are a few questions here already waiting for you. So let's work our way through them. Which medication did you have the best success with for safer stimulant prescribing? Do people have a choice? Does it take several tries to find the right med for the right person? Are you able to speak to that a little bit? I know that we also have a report from the Safer Stimulants evaluation, so we can share that with them here. But is there anything you want to comment on that question?
I think that would be great, because we did do a report that came out in the spring, like Rebecca said, that really kind of got into the nitty-gritty of we really wanted to tackle some research, of course, but we felt it was really important to put out really kind of detailed clinical information about how these programs work and the medications that are prescribed. And so I don't think I can speak to like what works better for other people. What I will say is in the report, you can kind of see a breakdown. Most people are prescribed some sort of long-acting stimulant. Most commonly, it was long-acting methylphenidate. And then most people are also prescribed with that a short-acting medication, which was most commonly short-acting methylphenidate or Ritalin. Usually Ritalin 10 milligram tabs. And very similar to a safer opiate supply program, it's to kind of address the withdrawals and address the cravings. People have really, really amazing outcomes. We're starting into another research study where we're going to focus on speaking with people on safer stimulants, which I think is going to be a lot of fun, because we're really excited about kind of the outcomes that have come from that program. And we're really curious to kind of dig into, from their perspective, why these programs are so impactful for them, what they find useful. But I think the biggest thing I would say is very similar to starting someone on safer opiate supply, safer stimulant supply. It's all about kind of starting with something that, you know, usually the long-acting methylphenidate and the short-acting, but then being willing to check in with the person, see how it's going, what are they liking and not liking. And I think that's the beauty of the program. But then kind of what works best is that there is kind of a menu of options available to people. And we also in that report put like at program intake, people were prescribed this, and then at the, you know, at their most recent check-in, this is what they were prescribed. And so you can see within that as well that, you know, people aren't started on one thing and then maintained on it. People are started on something and then it might work for a bit and then it's not working. So they go back to their team and they try something new. And so that's where I think the success comes from. But Athena, did you have anything you wanted to add? Because Athena worked clinically as well for a long time.
Beyond, like, it is very person-centered. That was really my answer as well. I'm not a prescriber, so I can't really talk on prescribing, but yeah, as Marlene just said, there is a report out in the last report that provides sort of clear, it's supposed to be comprehensive guidelines to help with prescribers to make those decisions, but people absolutely have a choice. As part of my job, I read every single charting note for every single client on the program in Ottawa. So I get to watch people's journey. Some people have to change 2 or 3 times. And that's totally fine and totally normal. They don't have to stick with whatever they first started with. It's completely person-centered. So that's kind of, I think, the beauty with the Safer Stimulant program is there's actually a couple of more options compared to standard OAT, where it's most frequently either Acadian methadone or Suboxone as a long-acting. There's a few options for stimulants, so that's really great that this can find something that works for people. So it's pretty simple.
Great. Thanks, Athena and Marlene. There's a question here about the relationship between participants, housing status, and treatment outcomes. Further down, there's also another question or comment, or maybe I saw it in the chat, about just the importance of housing and the work that needs to be done around addressing the role of housing in people's lives and the need for housing and getting appropriate housing for folks. Any comments on that?
Definitely. Yeah, I was just speaking to someone late last week about who wanted to look at like housing and safer supply and maybe do some research in that area. And I was like, yes, please. Like, I would love that. I think that would be great. I mean, I can speak like personally, anecdotally, overseeing a program for a long time. Particularly, I work the Ottawa Inner City Health Program, and that program exists within a shelter and supervised consumption site. So many of the people that we were seeing were homeless or unstably housed. But similarly at Recovery Care, they also saw people kind of who were homeless and unstably housed, that the difference clinically from my own experience is like night and day. Having somewhere safe that's your own, where you can lock the door, you can keep your stuff, and you know, have the ability to sleep safely and soundly and not worry about, you know, things like you saw on that criminalization slide. I know I flew through things really quickly, but or not in the criminalization slide, in the victimization slide, that people, you know, are reporting things like being beat up and being assaulted and having their stuff stolen. And, you know, when you're staying in a shelter, for anyone who's been in a shelter, who's worked in a shelter, who has experience with that, you know, there's not a lot of room. Your things get thrown away, your things get lost. It's just a really awful kind of cycle to be in. And so I think that, like, I can't underscore enough the importance of housing. And that is why we wanted to ask about it in the survey, because we felt like clinically for sure there's something there. And so it was really validating to then see that people were reporting that they were being able to get housing. What I would also say is the Safe Supply Ottawa in particular, this kind of initiative does have one of the 7 partners is Options by Town, which is a housing specific, like has housing workers specifically that like physically go to the sites, physically go to the shelters and seek people out to engage and begin the process of things like getting ID and getting all your ID back, and, you know, figuring out your bank accounts and things like that to be able to start the process of getting housing. So I think it's really important. And people also, like we mentioned, anecdotally spoke about kind of this major increase in feeling of stability and stability in getting housing.
And I think it's also accessing the Safer Supply program for the question, what do you think is contributing to significant change to improve housing? If I know, at least for recovery care, at the 2 downtown locations, there are full-time housing workers at both sites. So the entirety of the hours that the clinics are open, there is a housing worker in that office sitting there waiting just to speak to people. So by simply being on the program, it means you're accessing a housing worker who's there purely to help you connect with housing and resources. So I think that makes a huge difference, as well as our individuals who have a really hard time connecting with their workers. It's okay. We will have someone advocate for you. You don't need to have a cell phone. Like, it's erasing those barriers by being on the Safer Supply program. So there's just ways to do it. Yeah,
amazing. There's a couple of questions around challenges of being on the program and barriers to the program. I think you addressed I think you addressed quite a bit of that, talking about why people might end up leaving the program for a little bit, and also just the immense need of the program and the limited capacity of the program. If there's more wanted about that, can people put in more on like return to the question and answer box and ask more? Again, there's somebody here who's involved in advocating for housing and saying how important that piece is. And let's just have another look here.
But certainly kind of barriers and challenges is something that we wanted to really dig into with this, which is why the program wanted to why the Ottawa group wanted to look at restarts, because we were cognizant of the fact that safe supply programs are wonderful and they're, you know, definitely needed and very important, but we can always be looking at ways of kind of changing to meet the needs of people. And so definitely that was a big part of this. And I think you'll see in the report as well that it is. So yeah, it's just about kind of learning together and yeah, making sure we're addressing needs.
And which is something that all new programs go through, right? Whenever you have a new intervention, a new program, there is the growing pains of figuring out how to balance the resources that a program has to deliver services with the needs that people have and figuring out the right fit for folks. And that can be really complicated, particularly in you know, politically charged contexts and things like that as well, that, you know, complicate all of that. There is a question here about Health Canada, and have they stated what would be what's going to happen with the data around Safer Supply? Do you want to just take a second to talk about like the relationship between the the evaluation here that you're doing here, and then and what the kind of evaluation that Health Canada does, and the kind of reporting data that we have to provide.
Mhm. Yeah, so Athena,
Go first.
sorry, Athena, did you want to go?
Sure.
I was just gonna say Athena can get into it a bit more, but Athena can talk about what she presented on was the data that needs to be, so the things that the program accountable to Health Canada for that they have to report on, versus kind of what in the second half what you saw we did, which it was more of kind of the program evaluation research side. But go ahead, Athena.
Yeah, so the data that I present on is the bare bones of what Health Canada asks for, and it's what's required. So the quantitative analysis, they want to know what they really want to know is fentanyl use. That is their main bread and butter, and now as well stimulant use trends. That's what they want to know. They want to make sure that the programs that they're funding, we can prove they work. So with this data that Marlene and I are presenting, we can show them, especially quantitatively in their eyes of Health Canada, it's objective. If we're presenting, it's not an opinion anymore. It's not my opinion that Health Canada decreases or that Safer Supply decreases those. We can show through the data it does. It's not something that can be argued at that point, which is helpful for them, and that's what they require to ensure that the funding continues. So Health Canada, they haven't stated what they're doing otherwise, to me at least, or that's what I've heard, but otherwise, it's really just to confirm that they're going to continue to fund it. As of now, for the Ottawa group, our funding is continued. So our data is successful enough as of now to have them continue funding it, which is really important for our people, as quoted by the participants on the program. It's ensuring that the program continues for them.
And I think just again to speak on the kind of research and evaluation that's happening of Safer Supply programs, I'll just add that there is the required funding reporting that you're talking about, Athena. How many people are on the program, what kind of services are they accessing from within the program, all of that sort of stuff. And then there are program evaluations, which are also submitted to Health Canada. So yes. Health Canada will get these reports to understand about the model, the implementation process, and the impact, so that can include the qualitative data. And then there's also a third-party evaluation of SUAP-funded Safer Supply programs that are happening. Yeah. And then there's probably, I don't know, upwards of 25 other studies that are happening by researchers looking at some of the, very specific questions about Safer Supply programs, models, medications, medication regimes, all of that stuff as well. So these, that's why we had to have this research spotlight webinar series because there's just so much research happening right now about programs, the effect of programs on participants, and impacts on community and impacts on systems as well. I just wanted to talk for a moment again about discontinuation of programs and that crisis that brings them up, that brings about discontinuation, and then also how crisis brings people into programs, and crisis can also interrupt access to services as well. I thought that your data around people's experiences when incarcerated was particularly powerful, and we know that there's so much work that needs to be done for people who are entering into carceral settings around continuing their medications, be it methadone or be it Safer Supply. Yeah, I thought, yeah, that's a fantastic to have that data and the analysis around that available to add to the evidence base. Yeah, good stuff. Any other questions? Let me just check. There could be, yeah, a couple more have come in. Question about diversion and advocacy for Safer Supply. Do you think the study's learnings about diversion can be conveyed in a way that can counter objections that fixate on diversion, allegedly causing new substance use problems?
I don't think that necessarily the things that we collected on can specifically address that. But what I will say is I think that there is already research out there that addresses that, and research that is, or data that's being collected regularly. So you heard me speak about kind of very briefly at the end about youth and about how overall research has shown in Ontario, at least, that, and in BC, the BC coroner came out as well to say that there, hydromorphone is not contributing to deaths. It's not contributing to opioid toxicity. Things like within kind of that youth report that I was speaking about, that instead what we should be worried about is kind of the lack of services available to youth in particular. And so I think that there is actually already things out there to say that even if diversion is happening, which the participants, again, they didn't lie about it. They didn't say it happened all the time, but it certainly happened from time to time. That this is overall, it's not causing harm to people in the ways that I think that the media is sometimes making it out to be. But again, there's the coroner data, there's reports coming out all the time. Like, I do think that there is actually research already available that we can kind of, as a group, collectively bring together to really be impactful and say, they're here. Like, look at, there's the opioid something tool that looks at kind of opioid present death. And, if you look at kind of the graph, fentanyl has spiked, of course, around 2016. And even though programs opened around, 2019, 2020, 2021, there was no spike in hydromorphone present death. So things like that are available. And I think it's just a matter of us making sure we're kind of pulling it all together and being really clear that we do already have evidence on this, and it's being collected on a regular basis.
Thanks, Marlene. I really appreciated your comments around, what's driving people's substance use, inadequate pain management, unaddressed mental health issues. I'm just reading what some of the notes I took in your talk. Experiences of stigmatization, environmental chaos, and, going back to housing, we know that substances, drugs have really useful effects, right? Like, they can produce pleasure, they can keep you warm, they can keep you awake and alert so you can protect your stuff. And so they can be very useful when experiencing homelessness and other challenges. Of course, they're, especially in the absence of other programs and services that could address these issues better. Or in other ways. So yeah, the lack of, there was a report about someone who had died of of a overdose, an opioid related overdose, and real people were blaming it on access to safer supply, but then the family was also talking about how this person was accessing drugs from the unregulated market due to mental health issues and such. And it's like, well, maybe we need to go after that, the lack of services for folks. And I think you did a really good job, or your research is providing more evidence to support, increased access to those resources. I also really appreciated your slide and discussion about how the goals of the program, and how what you're finding from people is that the program is meeting what their goals were stated. And I think that's really valuable as well. Very quick question, off the top of your head, can you tell us the Safer Supply program capacity right now? How many people is the program serving? Do you know?
The last number I had for July 31st, or sorry, the amount of people who touched it in that program was 531. So there's always, slightly over 500 is what the program typically sits at. I found that this is my, I think, 4th or 5th quarter measuring, and there's almost always a consistent amount of people coming in than going out. The program is, at least in Ottawa, been capped for a little bit. So the need is definitely higher than that as well.
Yeah, which I think is another, point to the whole diversion issue, which is something I think all programs are very heavily invested in thinking about, talking about, and addressing. And that is that there is a very, like, the number of people on Safer Supply programs is very, very small compared to the number of people who are receiving hydromorphone prescriptions for dozens and dozens of reasons. Great. Okay, any last thoughts there? Oh, we have another thought here. I'm one of your many supporters living outside Canada. What can we do to help protect and support the work that you're doing?
That's really nice. Thanks. I think that as a group in Ottawa, of course, we absolutely are always in awe of the group that the frontline staff are doing every day, the work that the clients are doing every day. And so we're always hopeful that what we're doing with research is kind of reflective of that. And I think something that I feel like has been coming up more and more is just really making sure that we are kind of pushing the evidence and pushing the research out there. And that's just not, not just what we've presented today. There's lots of incredible groups doing incredible work. But I think making sure that we're really ensuring that things are pushed out, getting in the right hand. Once this report comes out, I'll be going on an email blitz. Probably lots of you will be hearing from me because I'll be sending the report to anyone and everyone who will listen, putting things on social media because yeah, I think, even things around diversion, we already have data that shows that hydromorphone is not contributing to drug poisoning deaths. And so we actually do already have a lot of data. And I think that we just need to be coming together as a group to really put things out there and making sure that, the voices that need to be heard are heard. And also, out of all of this research, of course, like doing qualitative research, my favorite pieces are the quotes that people are sharing. So I think like sharing those and pushing them out because that's really at the heart of what we're doing, really wanting to just communicate what, the stories that they shared with us. It was an honor to sit with them and to hear from them. And it was really challenging things that people had to recount. So I think making sure that we are kind of pushing their voices out there because they do want to be heard is wonderful. And thank you for your ongoing support.
Thank you. Yeah, that's actually, I think that's a great question for us to end on today, because again, like you say, Marlene, the amount of research that is being done, the amount of evidence that we are compiling now is really indicating the importance of Safer Supply as one tool in the toolbox for supporting people who use drugs, along with wraparound care and just an overall comprehensive approach to substance use health, and having it be accessible in the community. Great. Really happy to have all of your reports on our website as well, and continuing to provide space to hear about the amazing work happening at Safer Supply Ottawa. Thank you all very much. And
thanks everyone for coming. Thank you.
Thanks everybody for making time in your day to come and listen and learn. And we ask you to continue to share this information. Yeah, that's great. Thank you very, very much.